Congratulations on your new expander. We're going to go through together what you can expect from now moving forward throughout your treatment. One of the biggest and most important things to remember is to keep your expander and everything connected to your expander as clean as possible. A water pick is a great addition to your hygiene program in order to make that easier and faster for you to do. It allows the water to get underneath the expander and also all the way around the TADs in order to make sure that they stay as clean and healthy as possible throughout your treatment. So if you don't have one already, I would highly suggest getting a water pick. During the first 2 weeks after your expander is placed, the body is going to be going through a healing process. You want to avoid anything that could potentially slow that process down. The best things to speed it up is to keep everything clean and potentially warm saltwater rinses, mixed about a cup of warm water with a teaspoon of salt. Peroxide, alcohol-based mouth rinses, and anything stronger can actually delay the healing. Sometimes Ambisol and other local topical anesthetics can delay the healing as well, so you want to avoid those, especially for the first 2 weeks after your expander is placed. If you had an osteotomy procedure down the middle of your palate, you want to make sure that that area can heal completely. As long as you're keeping the area clean, it should heal normally. With the midline osteotomy, one of the common mistakes we see is that sometimes patients brush and use the water pick too aggressively. In order for the area in the middle of the palate to heal, there has to be essentially a scab form and those healing cells be present. So when you're brushing, if you've had the midline osteotomy procedure, you want to clean the area, but you don't want to brush or water pick so aggressively that it's removing all of your body's natural healing cells. Typically, when the body is healing, that scab will appear white or grayish in color, and you'll notice that when you brush the area lightly, it doesn't come off. So in order to clean that midline area, you want to brush it lightly with a soft or extra soft bristle toothbrush, but you want to avoid using the water pick directly on it, and you want to avoid brushing so hard that it removes all of that layer and it starts to look red or bleed. With the expander in your mouth, everything's going to feel different, especially chewing. Your body will start to naturally adapt and your chewing patterns will change as you get more used to the expander. But until that happens, you want to stick with softer foods and foods that are easier to chew. You might notice that you have excess saliva forming after you have the expander placed. That's normal. For a while, your body thinks that the expander is food, and so it generates extra saliva. You want to go ahead and just ignore that. Within a few days, that goes away completely, and just continue to practice your new swallowing pattern and your new chewing pattern using those soft foods until you're comfortable with more. You might feel pressure around the area of the expander and where the pins are. This is normal, and if it causes headaches or any other discomfort, you can go ahead and stick with your pain relief routine. Tylenol and or ibuprofen are what we find works the best. Because those two don't interact directly with one another, you can take them together or you can alternate them. As long as you don't exceed the box dose for either one, you can continue that until your symptoms subside. With the expander in place, you might notice roughness on either your cheeks or your tongue or both. If there is an area that seems to be causing roughness or scratchiness on your cheeks or tongue, go ahead and use wax to cover that area completely until your tongue and cheeks get stronger and get used to the expander being in place. For more detailed information on that, go ahead and check out our orthodontic wax video. If you have specific questions on how to turn your expander, go ahead and check out our video on turning the expander specifically. But here are some things you want to watch out for as you continue to turn your expander. With a skeletal expander, the goal is to actually have the top jaw move apart and become wider. When this happens, there is pressure, and there needs to be pressure in order for that jaw to widen. Pressure within the area of the sides of the nose or in the area of the cheeks is completely normal. When you turn the expander, you're likely to feel pressure in these areas. Also, the act of turning the expander itself, you should feel resistance. Go ahead and make sure you follow the protocol and prescription we set for you as far as how often to turn the expander. If you start to feel pressure way up here in between the eyebrows, you want to make sure that you let us know. Pressure in this area is not considered normal, and if you're starting to experience pressure here, let us know and we'll evaluate what's going on and make sure that your expansion is proceeding normally. Because everybody is different, oftentimes the turning protocols for your expander will change. What you want to know is that This is not a process that requires brute force. Although some pressure will be required for the jaw to remodel and to widen, if you push too hard too fast, it can cause complications to happen. So we're going to be guiding you through the process and recommending how many turns to do and when to do those. But as general guidelines, when you do turns, you should feel pressure, but you should not feel excessive pressure. If ever you feel excessive pressure, you can go ahead and undo the turn that you did and wait until the next day and try again. If you have any questions about that process, then go ahead and give us a call or text us so that we can work through that together. The best type of pressure to have on the jaw as it's expanding is a moderate, consistent pressure. And so your turns and turning protocol will be designed in order to try and obtain a moderate, consistent pressure as the jaw is widening. If you've had the osteotomy procedure with the midline split, one of the things you also want to avoid the first 2 weeks afterwards is aggressively sneezing or blowing your nose. The reason for that is because the top jaw is connected to the nasal cavity, and we don't want any of those healing cells between those two things to become dislodged or to create a communication between those two cavities. So if you've had the midline osteotomy procedure, again, avoid any aggressive sneezing and or blowing through your nose. Just go ahead and minimize that as much as possible for the first 2 weeks. The last thing we want to make sure you pay close attention to is that as your jaw is expanding, you'll notice that the level of the teeth should expand symmetrically, meaning that the edges of the top teeth are moving apart and they're moving apart on a flat horizontal plane. If you notice that one of the front teeth looks a lot longer or a lot shorter than the other front teeth, go ahead and stop turning and give us a call so we can evaluate what's going on with your expansion and we can move forward accordingly. If your tongue specifically is becoming sore and you feel like the wax is not managing that well enough, you can purchase on Amazon something called an RPE guard. And essentially what that is a layer of wax that covers the entire expander. Typically those work best during night when you sleep, but you can also form them in such a way that you can wear them during the day. Most of our patients will be able to use the wax to get comfortable, but if it's something that you're continuing to struggle with, you can go ahead and check those out as well. One of the things you may notice as you start to get expansion of the top jaw is that it may become easier to breathe through your nose. This is good because the top jaw and the nasal cavity share the same bone. As the top jaw widens, the nasal passageways open. So if you notice that it becomes easier to breathe through your nose, that's great. It means you're right on track, nothing to worry about, and we'll continue to see progress as you continue the expansion process. We've put together some videos that we hope you'll find helpful to guide you through your orthodontic journey. There's a list of those videos below, so go ahead and check them out. And if there's any information that you need, go ahead and give them a watch. So we're excited to have the opportunity to accompany you on your orthodontic journey, and we can't wait to see that beautiful smile that awaits you. Once again, if there's anything else we can do for you, please don't hesitate to ask, and welcome to our practice.